Vein Clinics of America has become a trusted resource for patients nationwide when it comes to vein disease, and for good reason. We visited their Chevy Chase location to hear more about the treatments provided and the facility itself.
So tell me what's bothering you.
Well, I have some veins.
Dr. Mehru Sonde has seen it all.
Typically, people will come in with visible large varicosities that are unsightly and painful, and any other complications that come from it, like pain, swelling, discoloration, ulcerations.
As medical director for Vein Clinics of America, first-time patients often arrive to her based on a referral from their primary care physician and can be uncomfortable and in pain. Dr. Sonde says she, her staff, and all the practitioners at Vein Clinics of America see it as their mission to help these patients and treat their vein disorders which are getting diagnosed with more frequency in recent years.
So vein disorder is basically genetic. It is basically failure of the vein valves to move the blood forward up towards the heart. Most patients who have family members who have had the disease recognize it a little bit earlier on by visible varicosities that they see. They can come for pain, like I said, visible unsightly veins, swelling, discoloration, cramping, aching. And of course, some of them will come just for cosmetic purposes.
Vein Clinics of America has offices across the nation and here in Maryland, including this one in Chevy Chase. VCA's doctors are all experts who specialize in vein disorders and treatments only, meaning patient treatment is thorough and expansive from the very first meeting onward.
When somebody comes in for a consultation, we basically do a visual inspection, full detailed history, and the extent of their symptoms. We arrange for a detailed ultrasound of all the veins, which is called a vein map, to evaluate the extent of their problem, and then go over the detailed treatment plan. Every person gets an individual treatment plan depending on the extent of their disease status.
Treatments are a lot less invasive as they were in the past as well.
We basically do a procedure called ablation, which is closing those broken veins with either heat, lasers, radiofrequency, or we do injections. And the ultimate purpose of that is to close the broken veins, which ultimately are dissolved by your own body. The treatment is tailored to the problem they have. Sometimes both the legs can have completely different extent of the disease, so one leg treatment can be completely different from the other, and it's done per individual leg per person.
Not only that, but Vein Clinics of America makes sure to always stay on top of the latest technology and research, ensuring that patient treatment is the best offered and recovery is as quick and painless as possible.
I think Vein Clinics of America has established itself as a leader in vein practice over 35 some years, and I think we do bring in a lot of technology and a lot of good knowledge over the years with research and good treatment outcomes for patients, so patients trust us to know that we will give them the best outcomes possible.
It's what keeps the doctors here excited about each new case they're presented with, the idea of helping patients reclaim their lives.
It's very gratifying. It's visually gratifying, and the patients come in and say, oh, my legs don't hurt anymore, or I can do all the exercising, or I can, at the end of the day, my legs are not hurting. That's very gratifying to see. I give you an example of a physician who was a patient of mine. Her main complaint was that she's not able to hike like she used to, and she thought she was a part of aging. Once we finished her treatment, she went out hiking like she normally loves to do, and she came in and said, I cannot believe I ignored this for so long, because she could do everything she used to do before, and she just didn't realize that these veins were slowing her down.
Dr. Sonde wants people to know that Vein Clinics of America is here to help and that they don't have to just tough it out with vein problems when they occur. Getting relief is as simple as one little step, making an appointment at VCA. In fact, it's the only step you have to make, since consultations, appointments, and every outpatient procedure happens right here on site.
It is convenient. They meet the same team. They meet the same nurses. So I think it really gives them a continuity of care and a sort of a confidence that the team really knows them, you know, from beginning to end. We do a lot of hand-holding so that at the end of the treatment, they feel that we really accomplished what they came out to get.
For more information, go to veinclinics.com or call 844-821-8346. We'll be right back with more Midday Maryland right after this. Stay tuned.